afternoon, good morning, and good evening, wherever you are watching us from. It is still me, your doctor and your doctor online, Dr. Izupechin, your wonderful doctor who has always been here to give you the necessary information that you will need for your well-being and in as much you love your health. And we say health is wealth. Please come closer, bring your seat closer. If you are a medical practitioner or a layman on the street, you love your health, you like doing things that are good for your well-being. Something happened in our office today. I just came out from our office services this afternoon. Something happened. A client came to our office and to our clinic, and she wanted to buy some drugs, and she said we should give her Ampiclos, erythromycin, and tetracycline. And while I was delivering those things to her, I asked her some questions to know her medical history and who is taking, and as well in order to give her the dosage. And then I discovered from her that she is actually the one taking the drugs. But then I looked at and acquired from her what she's going through that she wants to take the drugs for. And she mentioned the gastrointestinal disturbances and as well some upper respiratory problem. And then I discovered something. But actually, the reason why we are bringing this thing to you because there is something that is involved in this very medication that I have to warn somebody today. If you are a kind of person that you always go to a pharmacy or over-the-counter chemist or any clinic to get drugs and you always want to prescribe for yourself, I want to advise you to stop and desist from doing such, because such is very much detrimental to your health. It is very much detrimental to your health. Please stop and stop it exactly now. Stop it exactly now. Now, stop it. Stop doing that. Always get medical advice from your medical practitioners around you. You can always have one for yourself or even for your family. But then look at what I'm trying to show you to them. You know that very drug called Ampiclos. Ampiclos is a combination of two drugs, ampicillin separate and clozapine separate. Ampicillin is aminopenicillin, while clozapine is isozazalil penicillin. Both of them are synergistically put together to potentiate itself against some bacteria infection. And then what you should look at is what is the function, the indication of this very Ampiclos. Now, Ampiclos has an indication like in respiratory tract infection, urinary tract infection, septicemia, ear, nose and throat, and the rest of you, the other thing that it takes care of. But then, even also gastrointestinal agent is in that Ampiclos. But then, as according to the woman, she said that she's taking that drug for gastrointestinal disturbances and upper respiratory problem. And then she said we should give her erythromycin. Remember, erythromycin has also agent for upper respiratory and lower respiratory tract infection. And also, she wants to take a tetracycline, which is according to her precisely. And she said that she was already on that tetracycline as a result of the gastrointestinal disturbances that she's going through. But then what I'm looking at, the reason why we are presenting this thing to you today is because when it comes to what I've always told people, especially my fellow medical practitioners, please, even if your patient, in fact, if it will amount to you doing more studies, I will advise that you do more studies, because in our ethics, it is better to confirm from your book than to confirm from experiences or maybe death of a patient that you administered a drug to and the person died out of it. It is always wrong and dangerous. Instead of you to out of shame to quote what you are not sure, you better confirm it from your book in front of that patient before doing so. And that is what we talk about when we talk about drug interaction. Ampiclos does not have any drug interaction with that erythromycin, tetracycline, and which other drug? Allopurinol, for those that are on cases of uric acid problem, and you are taking allopurinol for reduction of uric acid content in your body. Please don't take that very medicine called Ampiclos, because both of them does not work together. They will expose you to another issue, even skin rash problem. It will still expose you to another health problem. And this very drug called probenecid. Probenecid is very dangerous when you put it together with Ampiclos. Please Please and please again, I have always been here with you, and I am your doctor, and I am passionately saying this because I know what many of our people are going through in the society today, from one degenerative health issue to another, because of the ignorances that some of us have been dragged into it, some of us got into it by ourselves, some of us purposely jumped into it because we felt that we know much. May I tell you the simple truth, you will not always know everything. Yes, as much as it is in medical world is always evolutionary. It is evolving every day. It is changing. Many infections that you saw yesterday, today they are no longer in the dimension that they operate. And that is why, like, for instance, ampicillin used to be taken as ampicillin previously before now, but due to the mutations that some bacteria have gone through and develop resistance against penicillin, ampicillin, our medical researchers have found out that potentiation will help to deal with that very bacteria, and that is why both ampicillin and the clozacillin are brought together. But then you, who happen to be a layman, want to take a medication, want to treat yourself of a particular issue without medical consent or without a doctor's consent and advice, hear you the truth. The truth is that you are endangering yourself for a greater risk. Please stop it. Don't forget, I'm still your doctor and your friend online, Dr. Isupechi. I've always been here with you. You see, I'm smiling now, but then I was like kind of frowning my face and talking to you because it's a stern warning. It's not good at all. But I will always be here with you. All you need to do for me to encourage me to go on this work is to click on that very share button and let your friends and your well-wishers know about it. And in case you are new to our channel, please do well to subscribe so that at any time we bring something like this to your way, you will be ready and you'll be there to get it. See you in our next video. I will always be here with you. Bye bye. Isupechi, making life green.